One of the big issues that we've been hearing about nonstop is we've got a new dental plan. Well, I keep reading conflicting reports. Well, most of the conflict comes from the government and then what reality is. But I wanted to get to the bottom of that. I'm very pleased to welcome to the show Dr. Robert Wolanski, who's the head of the Dental Association, BC Dental Association. Dr. Wolanski, first of all, I really appreciate you taking the time. These aren't the most fun things to do, although I'm a lovely guy, but the most fun things to do. But I think the public needs to know, and let me start with this. Um, to what degree was the Canadian Dental Association or the different provincial bodies consulted on the dental plan? I mean, did someone come and talk to you and say, what should it be? What should be part of it?
Right, right. Well, this process, as you know, started, approximately 2 years ago. And it was an initiative launched due to the confidence and supply agreement between the
Mm-hmm.
NDP and the Liberal government. So, it was political in its ideology and its nature. And initially, the CDA, the Canadian Dental Association, asked to be, a trusted partner in providing information. Uh, the Canadian Dental Association, and I just want to, state right out at the beginning, dentists do support the concept of increased access to care. In fact, the Canadian Dental Association has been arguing for that and lobbying for that for decades. So it was natural for them to ask to be brought to the table as a trusted partner, and they were to some degree. So was there consultation with the Canadian Dental Association? Yes. Provincial dental associations were not involved and invited to the table for about a year later. So it gives you a little bit of a timeline on that. And I think what it would be fair to say is that although the Canadian Dental Association did put together recommendations, they were really more or less ignored. They certainly weren't followed on. The Canadian Dental Association recommended something akin to a health spending account, which would allow patients and their dentist to choose whatever treatment they deem necessary. And instead, the Health Canada went to an existing on-the-shelf plan. And that was called an uninsured health benefits program. And that's the program that's being used across the country for First Nations peoples. And I have to tell you that it disappointed dentists because dentists are very familiar with that program, having worked with it for many years. They generally have an aversion to it. It's cumbersome. It's difficult. So that was the framework that the government started with. And at the end of the day, I don't know for sure, but we're suspecting they did that because they were trying to roll this program out quickly. The program was rushed, and it had to be because of the political timeline. So, whereas the minister said this program would normally take 5 to 7 years to develop a well thought out program, this had to be rolled out in 18 months.
Is that the nature of or the concerns? I'm sorry, I'm going to talk from a patient for one moment, just
Please.
to clarify. And that is, are every procedure covered under this? If I'm eligible, let's start with that. So I'm not going to go into that, but I say I'm eligible. What I've heard anecdotally is that doesn't mean that, like, so if my dentist says, you need X done or Y done, that's not necessarily covered. I mean, there's a prescribed set of procedures. And for
Right.
me, I likened it to the pharmacare program where only certain drugs are going to be okayed. Is that the case with this?
Yes. Again, it's being claimed that this program is very similar to normative insurance plans and would have the same basket of services. That's simply not true. The number of fee codes that dentists bill is almost 1,500 fee codes. This program covers
Wow.
about 420. So that's something like that.
Yeah.
I'm ballparking it, but it does not cover all procedure codes, as well as it is being touted that this plan has no limits. And that's challenging because the financing and the amount of money will be limited, and there has to be some degree of control or limits. The way they're doing that is indeed by restricting procedures. So there are numerous procedures that will not be covered. And frankly, we don't even know what that will look like because this program is in its infancy at this point. We won't know what that looks like until November when, pre-authorization and predetermination of benefits, start to come out, and we'll have a better idea of what will be covered and what won't be covered. But essentially they are limiting the amount of money that would go towards the payments and towards this program by limiting procedures and frequencies of procedures as well.
Can you estimate how many dentists have signed on to this? I've read various reports
Yeah.
that anywhere from only 50% have, but far more have not. So just again, anecdotally, but
Yeah.
just your impression.
Well, it's difficult. The only people who really have those numbers is the insurance company Sun Life, and of course the government has those numbers via Sun Life. What we do know is the numbers were extremely low at the beginning, and dentists were highly reluctant to sign up for the Canadian Dental Care Plan simply because they didn't know the details of it. And the details were being released. I've described this plan as basically like building an airplane in the air while it's flying.
Mm-hmm.
And the one thing about dentists, and this is one of the biggest reasons that they were extremely hesitant, is we have a mindset very much like engineers. We like predictability. We like perfection. And of course, as a patient, that serves the patient well. You want your
Yeah.
dentist to know what they're doing and feel very confident and attain a level of perfection as opposed to flying by the seat of their pants. So that's just kind of our mindset. And that made it extremely difficult for dentists to just say, oh, yeah, this sounds great. And again, remember, dentists are very, very familiar with government dental plans. Most dental plans that exist provincially across the country have been created by dental associations over decades. And we also see how over the years that they can degrade and erode, and they are very, very challenging. So, given the fact that it was an NIHB framework for the plan, and there were very, very few details, certainly initially, we're getting more now to Health Canada's credit. It made it very difficult for people to want to sign up. And one of the initial challenges was that the Health Canada could unilaterally change the terms and conditions of the agreement. That they've changed that, and again, to their credit, and that made it easier for dentists. Currently, we have a formal registration process, and the minister did introduce something called an alternative pathway. And
Mm-hmm.
that was something where you didn't have to register formally, but by submitting a single claim form, you would essentially de facto be agreeing to the terms of conditions. And those terms of conditions are different than other plans, and that's another challenge. Is the terms and conditions are between the insurance company and the dentist, where in all normative plans, they're typically between the patient and the
Yeah.
insurance company.
I'm trying to, again, I find it confusing about, lots of people already are on dental plans through their work.
Right.
They have an existing dental plan. And again, let's put a check mark if they're lucky enough to. Every self-employed person listening to this is going, are you kidding me? But,
Yeah.
so many do through their workplace. And I'm trying to think what the relationship will be, what that impact on, and they're very happy with those workplace plans,
Yeah.
but I'm just not even sure what happens going forward when you already had a workplace plan, or maybe you're on a significant provincial plan. Now what? Uh, do you have any idea of that yet, or is that is that raveled further?
Yeah, well, we'll be finding out, certainly as time progresses. As I say, we're still building the plane. Um, there are a number of points on that. Somebody who has
Yeah.
an existing insurance plan, most of those insurance plans have been created over decades, and we're dental offices are very familiar with how they work, and very comfortable with them. And most of those plans have very reasonable levels of coverage, and cover a good majority of the procedures that we do. Not always all of them, and sometimes they cover percentages of those procedures. But again, we're very,
Yes.
very familiar with that. And one of our concerns is what we're terming the risk of deinsurance. And this has unintended consequences in a number of ways. A number one, towards the government. Just for sake of argument, let's say all the insurance plans were dropped and everybody switched to CDCP. What would that require in terms of financing from the federal government to pay for it? So that would
Yeah.
destabilize and probably crash the program. So we are very concerned about that risk of deinsurance. And the other concern is a patient might not have the insight or the knowledge to understand that their existing current plan gives them a very reasonable level of coverage. Whereas the CDCP, by switching to that, it may be a degradation in coverage, and where they think it's all the same and everything's covered and all procedures are covered and it's all free. And unfortunately, a lot of those messages have been put out there by government and politicians. Unfortunately, that is not the case. And I just saw a patient yesterday in my office, and he he came in and was asking about the CDCP. And when I kind of gave him an idea of what was we think would be covered and what wouldn't be covered, again, he was in some sense maybe brought to a little bit of a point of reality and disappointed. But some people say something is better than nothing, and there is some truth to
Mhm.
that.
No, absolutely. But I think, as you say, politicians have put out there a pretty one-sided story, and I just think it's in the interest of the public to know exactly what they've got into, and the interest of taxpayers. The public is one thing, as patients, and taxpayers is another.
Yeah,
And I just think that's been, and these are my words, absolutely not yours, but a bit of a whitewash. It's not that simple. It's not that straightforward. People are going to be impacted. Taxpayers are going to be impacted. So it's a long list. And as you say, and I'm hearing you loud and clear, this is a work in progress. We may let's talk again in 5 years, see how it worked out.
yeah.
But at this point, there seems to be a great deal of uncertainty. And again, I've heard that anecdotally from dentists.
Yes, yeah, and that's pretty much true across the board. As dentists are starting to participate, some are finding, that the program is working for them, and that's great. And
Mm-hmm.
others, have tried it and are backing away from it. So it does depend a bit on the nature of the practice as to how this will fit for them. For us as associations, it's truly the long term effects, the consequences, and the stability. And we as dentists, I mean, we're taxpayers too. So
Yeah.
we're always concerned. It's how we run our offices. Dentists really aren't true business people. What we are is we are people that manage an office and manage our patients. Dentists mostly want to focus on just being dentists and doing what we do best. Um,
Yeah.
so that is always a concern for everybody. We do feel that we want it moving forward to assure that the people that we want to target are receiving care through the plan. That's important. Um, and there are going to be challenges with regard to some people who are not going to be able to receive that care for different reasons. And I'll just cite one example. People that are homeless, or people that is sometimes people on disability. The program requires the filing of tax returns. Some of those people don't file
Mm-hmm.
tax returns. What happens with
Sure.
them? So we have, so dentists want to advocate to try and help to get the people who really are the vulnerable people who would best benefit from this program to be able to access that care.
And I am right on board with you on that one. I mean, I think that's absolutely. We can get that's another conversation, but this one's been very valuable for me, and I hope for the audience.
Mm.
Dr. Wolanski, thank you for finding time for us here.
Yeah, my absolute pleasure. And I would probably just finish with Michael.
Mhm.
I kind of really never imagined that politics would play such a big role in my ability, to be a caregiver, and to ensure that my patients get the best care that they deserve. But that's where we are.
Good stuff. Thank you.
Okay, thank you so kindly, Michael.